Hi, I'm Swathi, a psychologist working at Asha Neuromodulation Clinic. Today I'm going to talk about ERP as a treatment method for OCD. So ERP is known as exposure and response prevention. It is the gold standard treatment method that we use for obsessive compulsive disorder. Just like how there are two portions in OCD, obsessions and compulsions, there's two parts in ERP as well, exposure and response prevention. Let's try to understand this with an example. For example, a person who has fear of contamination, they're usually scared of dust or germs, and they feel that they might get infected if they touch a surface which is filled with certain particles. So in such people, they end up avoiding the surfaces, they do not touch the surfaces, and if they do touch the surfaces, they go and they start washing their hands repeatedly. They may start counting, or they may spend 20-30 minutes just washing their hands. So here what we can see is that there is a pattern, there is a cycle of OCD that happens. A person usually exhibits this pattern where initially there are obsessions, which are repeated thoughts which are distressing for the person. Because of the repeated thoughts, the person feels a lot of anxiety. And because they want to neutralize that anxiety, they end up performing a compulsion or an action, which is hand washing in this case. So now that we have understood the cycle of OCD, and we have understood an example of how it seems for a person with contamination fear, what we try to do with ERP is we want to expose the person to the obsession. We want to prevent them from responding to the compulsion. So in the same example, we want to make the person touch the surface that they're very fearful about. We want to ask them to touch the surface that causes them a lot of anxiety, so that they can learn to live with the anxiety, so that they can be okay with the distress that occurs inside of them. And the second part, like I mentioned, response prevention. We want to stop them from washing their hands. We want to stop them from performing compulsions. So this is how we break the cycle of OCD. This is how the person learns to be okay with anxiety. Ultimately, they feel okay with it. The discomfort is not so severe for them anymore, and they realize that thoughts are just thoughts. They will not become reality.